Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, my guest is Donald R. Isham. Now, Donald has more than 35 years of business development, marketing, sales, and general management experience, preceded by a series of increasingly responsible IT and financial management positions here and abroad. He possesses a unique blend of business experience and technical, practical understanding. He's proven ability to apply the latest information technology solutions to optimize business profitability in a variety of industries such as the healthcare, pharmaceutical, financial services, manufacturing, and more. And I want to welcome to my show this very, very interesting guest, Donald R. Isham.
Thank you very much, Susan.
Well,
introduction.
Oh, well, I'm delighted to give you that because, of course, that's what you've been doing for 35 years. So with all of that experience, there's a lot for you to talk to our audience about and teach them what's going on in this now world of the IT and the computer and all of the technology. So let's start by asking you the first question, which is, what is the problem that has influenced not achieving the goals of the High-Tech Act of 2009 by 2014? How did that happen?
Okay, well, first of all, in the industry and focused, as you mentioned, across all spectrums in IT and businesses, but the focus right now is where medical information is the foundation of modern medicine. And timely access to the patient's medical records helps physicians make better decisions through coordination and continuity of care at the point of delivery. And they can provide their patients with higher quality of care and avoid many redundant and often harmful medical procedures. Fewer redundancies and medical errors will naturally lead to the much-needed savings in health care that our government expects through the High-Tech Act.
Yeah, but Don, let me just interrupt you for a second.
Sure.
Doctors have been complaining that they have so much work, and that's why they're giving their patients so very little time. Now, with all this IT that has been established, how do they get themselves more time for their patients rather than having to do with all the regulations and all the technology? What's your solution for them?
Well, there is a solution in terms of the actual technologies that are employed. But the issue, and in fact, it's a good point that you raise, is the barriers to the adoption of electronic health records. Doctors are typically, when we visit them, we go through the check-in, check-out process, but as we're going through our exam, they're entering data about what their findings. And that could be just a general physical, or we could be in there for a need. But it takes time for the healthcare provider to be able to work in a different format, and that different format happens to deal with the concept not with just the electronic medical records that are entered into their on-site or on-premise systems, but those electronic health record systems that capture our data, and it is actually moved into an external system called the Health Information Exchange. The purpose of this, Susan, really has to deal with understanding health data and how it is actually applied to our health based on many instances and experiences by different doctors, right. And and this is where we get into the concept of coordination and continuity of care, and that data has to be shared with us or with the doctors,
right?
And eventually we start to move toward the patient as taking responsibility for their own health care in coordination, obviously, with the their healthcare providers.
Right. So I can't help but asking this, which is that now we have a new president, President Trump, and he's going to change things, I think, significantly in the healthcare industry. What do you think he's going to do that will change what we see now?
One of the things that is kind of a concern among many of us is moving toward a single healthcare system and payment system. In one respect, we're talking about the Affordable Care Act. There are some very good points. In fact, me personally, since I have children, I really like the idea that I can have my children who are going to college and they're technically living with me. It can still be covered under my plan at up until age 26, and that's really helpful, especially when your child is in college or doing whatever school or pursuing their careers. The other piece of it is from the president-elect Donald Trump. As we start to move forward, there had been much said during the election process, that this was going to be eliminated. The Affordable Care Act was going to be eliminated and redone. Although, and I agree with recent statements made by him and others, that they're looking at the Affordable Care Act. There are certain things in that act, like I had just mentioned, keeping your children on the plan until age 26, but very important, pre-existing conditions.
Right.
And so I've always been a proponent that they will pull out, and when I'm talking about the new administration will start to look at the best parts of the Affordable Care Act and keep it. The issue, and as we're seeing, is that the competitiveness has gone down. Prices are going up in terms of the premiums. And that impact to the economy, to us individuals that may want to keep our doctor and our insurance is going away, and that is of concern.
Yeah.
And so.
All right, let's talk a little bit about the Affordable Care Act for a minute. Now, even though it might disappear, I think it's important for people. They keep on hearing about it, the Affordable Care Act, and Mr. Obama's desire to make sure that every person in this country has health care insurance of the sort. Now, what exactly? I mean, define it. Give us a definition of what the Affordable Care Act really was. And when you talk about that, let's kind of understand a little bit more about HIPAA as well, because, all these things exist for a while. But, interestingly enough, I think people are interested in understanding them a little bit better. Okay.
Well, there's two concepts. Okay. HIPAA's been around for a while, since 2006. And with HIPAA, we have, of course, the privacy of our health records. And actually, this is a concern for all of us, because polls tell us that Americans are very protective of their health care, even to the point where, as this information, our health data, and through our visits to the doctor, and it could even be from an emergency room, is recorded.
Right.
And in order for the goals of the HITECH Act to be met, which is the transformation of healthcare, data has to be captured in electronic format, and that scares people.
Yeah.
And to the point when you're going through your interview with the doctor, people will lie. Case in point, if somebody has HIV, they really don't want that out there. and even with the doctor, because that goes in and will end up in an electronic health record. Now, it's de-identified as opposed to your the difference between what we call an EMR, electronic medical record, is what's in the doctor's system.
Right.
That information is then put together and sent to an external system called a health information exchange. And this is available to the healthcare community in general. Mm-hmm. And its intent is to help improve data, because we know, for example, our health is actually affected by geography.
Of course. For
example. And so when having said that, it's the concern, again, is the privacy issue of HIPAA. The other thing with HIPAA, and then I'll get into the Affordable Care Act, the other thing with HIPAA is technology HIPAA has not kept up with the available technologies that are out there today. Hence what I have focused in. So there hasn't been, HIPAA has to be updated from a privacy issue, how it's managed, how it is captured, and how it's designed to protect our privacy. That hasn't been done.
Why do you suppose that hasn't been done? I mean, you would think that in having HIPAA would be a very important thing for the U.S. because, as you just said, there are people with certain diseases that if they let people know about it, they won't be able to find a job. So, why is it so? Why are we behind when you think we're moving forward with so much in the IT world?
Well, there's the difference: the IT world and the legal world. And HIPAA has been there. The government, our government, has not really addressed it from. They look at the IT data, okay, or the data collected by IT systems, health data, and that is done from activities going and trying to even define how the whole health information exchanges work. But there's been barriers to the number of barriers from the perspective of the doctors. And some of them aren't willing to even participate in this, especially the older doctors. And I'll actually put a line there, older than 50.
Okay.
Right.
Well, that's actually the young generation right now. If you're 50 or over,
yeah, I guess so. Thank you.
I'm glad you just said that. Yeah. Well, okay, go ahead.
Right.
Yeah.
Sure. But then you have the legal aspects of it, and the government has not addressed that relative to the new technologies in collecting this data. And as we are very much aware, look at WikiLeaks.
Yeah.
And the capturing of data from another source outside of our country as well, that isn't, there aren't ways to capture where that the laws of HIPAA that will apply to the transfer and interpretation of patient data. And in the best way I can understand it, or maybe help you understand it, is the data that, as we're going to the doctor, there are certain things that are embedded into the system, are coded in the system, that will prevent the system even providing information to another system, say within the office. It's very simple, into a Word document, a Microsoft Office document, for someone to capture that and then maybe send an email out to another third party. So some of that can be prevented. But in HIPAA, those rules that are embedded in the software, the medical record management software, are not there. Hasn't even been considered. Now, this then leads us toward, I had alluded to the fact there was certain barriers from your healthcare providers that they're not going to adopt. But it also then says to the general population, how do I protect myself against being in violation of HIPAA rules when it's not even embedded? Therefore, the software developers, the health software developers, are not covering this into their and assuring this data leak, if you will, cannot get out of the system and for unintended uses.
Yeah. Now that brings up the point of the significance of health data. I mean, what is that?
Okay. Well, the view of the HITECH Act, and of course, one of the visions of it is to be able to improve the quality of care for the patient. And the significance of this, quite frankly, is to save billions of dollars. In fact, even trillions of dollars.
For whom, though?
In healthcare.
For whom? Is it saving money for the general population, or is it saving money for the healthcare industry?
All of the above. Okay, so our out-of-pocket expense, our general delivery of health care, because now the doctors will have information available to us to support the concept of coordination and continuity of care. And therefore, we're not in with the doctor just in the amount of time we have to spend with the doctor. But more importantly, the doctor is now in a position, in theory, that they can now deliver better care to us. Hence, it's going to not only save cost, but identify issues that can be taken care of at a very early stage in the development of, say, of diabetes.
Yeah. Oh, that's a very interesting
Mm-hmm.
thing when you talk about diabetes, because there's an influx of more people with diabetes than ever before. And is that because there is a lack of education about healthcare matters?
Yes, and this is where we start to move toward, again, with electronic health records and what we call the interoperability or sharing of health data among many entities, both for not only the healthcare providers, but for the patients themselves, we as the general public. And, yes. So go ahead, I'm sorry.
No, go ahead, finish.
Okay, well, the point being is that we are able to now take responsibility, for example, early stages of diabetes. It's not like there's a pain, okay, or we have a heart palpitation or an issue with maybe bone marrow cancer. But diabetes creeps up on us. So now we start to look at a plan on diet that can be provided to us, and that can be based on many factors. And again, on the interoperability and the sharing of the data, where we now start to apply what we call data analytics. So we get into a predictive mode. And if I continue this process in conducting my life, my diet, my exercise, and maybe even certain medications, that all of a sudden I have diabetes, and then we have to start where the disease has it so advanced that some of the things we would normally do to prevent that, like diet, is not available to us.
Yeah.
And now doctors have to take drastic actions.
Well, see, this is an interesting point, too, that, whose responsibility is it if a person smokes and they've been smoking all their lives, or they're obese and they really want to be covered for all these different illnesses that can happen as a result of being obese, Do you believe that it's the responsibility of everybody to pay for them? Because the insurance goes up when that happens. How do you handle that?
Well, this is another area where the data that's being captured. Right now, we can determine if you're smoking, something ridiculous, 6 packs of cigarettes a day.
Right.
Okay.
Mm-hmm.
And I make that choice to do that. Well, as we're starting to move forward, and I'm using this data,
Mm-hmm.
Or ignoring it. Okay. If I decided that it says the prediction would be you're smoking 6 packs of cigarettes a day, the likelihood of gaining lung cancer or any other cancer is X plus Z. And you know what? You're going to probably die at a very early age.
Right.
Now, this takes all this healthcare data, and although that sounds logical, I don't mean to be trite about this, but the fact of the matter is we get into the point I want to make is we get into a predictability mode here.
Mm-hmm.
And now we can start to look at, basically, you're going to die.
Right.
So now let's get back to the cost. The doctor sees this information. He has access to a patient who smokes cigarettes. It doesn't have to be you. 6 packs of cigarettes a day.
Right.
And I don't exercise, I don't eat properly, and so on. This is what's going to happen. Now, are you really serious, Mr. Patient?
Right.
Mrs. Patient, are you going to start doing what we say? And then we can provide a program. Hence, this goes back, this coordination and continuity of care that fits the medical problem.
Right.
All right.
Mm-hmm.
And so then we as patients have to make a decision. Well, then what would happen if I continue to choose to live the lifestyle I'm living? You know what? I'm not going to get the care because we're not going to provide it.
All right. So set up this. Go ahead.
Yeah, and hence the impact on the financial aspects of healthcare cost.
Mm-hmm. Yeah. Now. Because why?
Well, I was just going to say it's because we continue to add to the cost of healthcare delivery, and we're not getting the results just because we have not accepted what the outcomes will be, and we just go to the doctor maybe to get medications, pharmaceuticals or whatever,
sure.
And it might make me feel better at the moment, but that's it.
Yeah.
So on it goes.
Don, very often you hear debates about healthcare systems, and people compare us with countries like Canada or Great Britain, and they say that, when you talk to the people who live there, if they don't have really horrible diseases, they say, what a great system we've got. We're covered for virtually everything, and, we never have to worry about getting good care. Now, do you believe that or not? Because I know that many, many people from Canada, when they have really horrendous diseases, come to America. So I want to get your opinion about that.
Well, here's the thing with, and I would kind of term this more socialized medicine.
Mm-hmm.
And I can speak from experience. I lived in England for 7 years. And it was basically you went to the doctor. You had maybe for a physical, you would take, your vitals and so on, and they'd ask if you'd had any problems, or if you experienced any issues. And then at that point, even to get a blood test, you were sent to another location.
Oh.
And yes, and to go to that location, sometimes I remember one of my physicals, I had to get a blood test, and they sent me to another location. It took 2 months to get an appointment.
There you go.
And yes, and then I wasn't even sure because I had no information coming back to me and said, Don, you have low blood platelets, white blood cells, and so on, and here's what it can do to you. That information could have been very important to me, because if I have low platelets or white blood cells, I start to become more open to other diseases. Mm. All right? And so there was never this exchange. So on the socialized medicine piece of it, it was almost like, you better come to me with a problem, then I'll work with you.
Wow.
Yeah, but to your point is then what happens if it's serious, like open heart surgery, okay, or cancer. Those that can afford it come to the United States for care.
So there's a disparity, is what you're saying. So if you're, you know, you've got a lot of money, and you know you're, well, basically you're able to cross the borders and come and get good health care in this country. But if you're poor or even middle class, you have to wait, like you just said, and that could be a major problem. Well, I think people need to know, they need to understand a little bit more about healthcare, because very often they will say, again, out of, I think, sheer ignorance, they'll say, well, you know, look at all these countries, they have great health care and it's socialized and I don't have to worry for my whole life. But what I hear you say, and I think it's probably true, is that, yeah, it's good for the poor, but it's not good for the rich, and in some ways it's not even good for the poor. You know, it seems to me that it's, in this country, we need a lot more, and I'll just repeat what I said before, education. Education. So if you were to set up a program, and I think it should be for like college kids or maybe even high school kids, so that they understand what they're getting themselves into in the future, what would you tell them?
I would tell them, and the younger children at a very early age, is I would be telling their parents to be able to set up a healthcare program structure that will be defined by how, again, this concept of coordination and continuity of care as we start to grow and develop throughout our lives. And it's like anything else, at a very young age, you start to learn what is important. Why, Mom, am I getting this cough? Why am I can't walk? Because I got cerebral palsy or the onsets of it? So I start to learn how I can develop my knowledge through this healthcare information exchanges, those exchanges that are going to give me information I learn at a very young age. Typically, when the child and the young people are moving forward, they're not learning this. I'm sick, I'm going to go to the doctor, I'm going to get some kind of cure, and that's where it ends.
Mm-hmm. That's right.
But during that period, I don't understand my health care. And I'm talking about, we don't have to understand the technical parts of it. That's the partnership with the healthcare provider or providers.
Does that include only physical health? What about mental health? It seems that it's very difficult to get good insurance for mental health. People don't recognize that there are thousands upon thousands of people with depression and anxiety. What do you account for the fact that there is sometimes, of course, there is good health care for people with certain kinds of disabilities, but if you have a mental disability, it doesn't exist?
Excellent question. And that is, we've been focusing more on, you just mentioned the physical disability. From the mental, unfortunately, after the fact, there's a behavior that is displayed from a child. It might be they can't concentrate on their studies. There's maybe a certain anxiety about them that affects their performance. Even their ability to work with people, with interaction with peers and family and so on. And then it becomes, because the data, Susan, the data isn't there. This is this whole health information ability to understand the data and how we can predict mental health outcomes.
Right.
It just isn't there. It isn't being captured. And then we get into what this whole new generation of data analytics, health data analytics, where we can start predicting in case of mental health behaviors.
Right, right. So what kind of courses, what kind of things do people who are going to enter college need to have in order to get involved in this new industry? Because it sounds like it's going to move ahead. It's going to be a big industry where people can get jobs. So what do you want to tell our audience again about what you do and how they can get involved in something that has a good future?
Well, from a healthcare perspective and from the technology, there's tremendous opportunity for students or for not only college students, but from a technical aspect in information technologies, and we deal with health information technologies, that we start to gather this information and how it is going to be designed. The systems are going to be designed and developed. So there's several things here. One, you have the actual software, if you will, the applications that are created by our software developers. And that's the technical aspect. So to your point, do they have to go to a 4-year college program, or can they start to work with technologists? And by the way, I'll say that there's like a 40,000 shortage, 40,000 human resource shortage in technologists for healthcare.
Wow.
And that's one of the issues in terms of developing the system and understanding it. Then from a understanding of how healthcare is delivered, and this information gets into what we call the health information exchange, where that's the interoperability of health data to help the doctors coordinate their care and moving forward. So there's a lot of opportunity just by the mere shortage of resources, technical resources, and then the understanding of what we do in terms of how those processes are implemented within the practices themselves and other healthcare providers. So notice, I didn't say technology, okay?
Right. Mm-hmm.
It's business processes, engineering those processes. So there's a lot of opportunity to be able to work with the healthcare providers, the healthcare community in general.
Mm-hmm.
So and some of this would require, say, a business perspective within the healthcare.
I see. So you're combining both. You're combining the business experience or business courses or a degree in business along with a technology degree that will give them the opportunity to really do a good job and to have a job. Because
in healthcare,
exactly. In healthcare, yeah. Okay, so now we're almost at the end of our show, and I think it's really important, Don, for you to let our audience know what you think is the most important thing about this particular subject and how they get involved, how they speak to you or get the inspiration about this industry for the opportunity of getting jobs in the future.
I think one of the first things is that we have to have a more of an intimate relationship with our healthcare providers. And my advice, and really the people that I've been associated with, is get involved and talk to your doctor. Understand what are they doing other than just taking your blood pressure, your vitals, and so on. So how does this fit in? Understand the process within the practice itself. And if I'm working not only with a specialty like a cardiologist, what is coming back that I can understand more about my condition as it applies to my location, my geography, as it applies to my progress, as it applies to what's working and what does not. And that has to come through the approach to your doctor. Would you go out and just buy a car off the lot without talking to somebody that would understand the difference between a BMW and a Lexus or an SUV? You would learn from the technical experts and the people that work with cars the advantages and disadvantages, the things we need to be continually doing to improve our health, or, hey, stop certain behaviors and actions. And that would be my recommendation, but also read about where this is all going. There's literature out there that is something that we can all understand. You know, we don't have to be technical experts in healthcare, okay? But we can learn a little bit about what, as we're moving toward more electronic delivered data and cognitive aspects of our health and how we feel, that now when the things that we're speaking about here today come up, get a better understanding about it.
Right.
And really, we're going to start, as I mentioned before, we're going to start taking responsibility for our own health care, as Gartner calls it, the quantitative self. And this is where we're going to experience this cost savings, and we're going to eventually trust the system because we're going to know when there's maybe security leaks and so on. But we have to get involved. This, I always said that healthcare, as it's delivered today, when we're going through this whole transformation and healthcare of the future, but as healthcare is delivered today is going to go by the way when doctors made house calls.
There you go.
And we have to, understand that. So knowledge is key, but we don't have to become technical experts or understand the technology. We need to understand how what this means to us, the impact of data and information.
Yeah. Great information for our audience to know. My guest today has been Donald R. Isham. He has more than 35 years of business development, and he's a friend of the Susan Brender Show, and I think he's given you a lot of information because it's very important that you learn, you understand that it's your responsibility for taking your own health care in your hands. So I want to say again, thank you so much for being on my show, Donald Isham.
Oh, you're welcome. Thank you, Susan. Appreciate the opportunity.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.